When Voyager 1 launched in 1977, I was just 4 years old. The Voyager missions by NASA are really inspirational to me. I mean, it's probably the closest thing to magic that I've ever seen. A few individuals that had an idea and inspiration. No one had any idea how long it would last. They thought it might last a couple of years. And now, it's more than 30 years later. And now in 2012, they're 11 billion miles away from Earth. They've shattered whole libraries of scientific thought. You can judge the whole effort by the number of scientific discoveries it makes a year and the number of previous theories that it renders obsolete. I think in a small way, the PCCI has a similarly improbable mission, but with the same promise.
In the late summer of 1977, two unmanned spacecraft, Voyager 1 and 2, lifted off from Cape Canaveral atop Titan Centaur rockets.
I like to think in our own small way, the Parkland Center for Innovation is like that Voyager mission. We're launching in 2012 out of a public hospital that has a great heritage. We're inundated with data, and medicine in particular. And the idea with the center is, can we take all this data and make sense of it for the patient? And I presented the idea to Ron Anderson, and he said, let's make it happen. Let's make it happen here at Parkland.
It's an idea whose time had come, but it was also a leader whose time had come.
I think no one really had any idea what they were getting into at the time.
We had a simple idea. Could we predict what would happen to a patient and when, using all the data we could get from the Parkland electronic medical record?
I always kind of wondered about that. I thought he was kind of dreaming, but then things just started happening.
Tim is a background type of guy, but he's been essential and started with me, and we had this idea.
The work that he was doing sounded really exciting for us, and started looking at some opportunities for how we might collaborate to bring the PIECES model and establish it at Texas Health Resources.
This is how PIECES works. It essentially sits on top of a hospital electronic medical record. It takes data from the operating room, from the wards, from the outpatient clinics, and then it says, what's going to happen to this patient and when? A lot of what we do in medicine as doctors is try to predict the future. We want to know, what does this patient have? What will happen to them? Do they need to go to surgery? Do they need to just get medicines or reassurance? And that's what we try to build into PIECES, the spirit of what a physician does every day, right into the software code.
One single physician cannot absorb and calculate and make decisions with, terabytes of data. That's just not humanly possible.
What's exciting about the PCCI is that it's composed of people that are still involved in providing patient care. So they actually know what it's like to be using the tools that they're developing in the actual care of the patients at the bedside. And that's a very unique aspect of PCCI.
In some ways, I think that we started our work in the Parkland Center for Clinical Innovation on one disease, heart failure, on one condition, readmissions. And the approach that we're taking, which is to take all that information that's coming from those patients and applying it to understand predictions throughout their hospital stay and beyond, can be applied to all the disease conditions in medicine for all age groups.
We are actually predicting what is going to happen to a patient before it happens, and then actually preventing it from happening.
And we tackle these really complex challenges in healthcare, but we tackle them head on, and we don't shy away from them.
The solutions what we are building at PCCI, the ideas, we are taking all those things and indirectly helping the patients without their knowledge.
I think a lot of us drive into work every day thinking that PIECES may help some little kid somewhere that we'll never meet. And that drives us and motivates us every day.
It's cutting edge, it's novel, it's innovative, and this is what makes this work exciting.
It impacts healthcare across the nation, in fact, globally. And so that's why there's now interest from multiple health systems in the work at PCCI and bringing that work to their health systems.
We have an amazing group of staff. I mean, we have computer scientists, mathematicians, health services researchers, clinicians, and we're all focused on how we might collaborate together.
So I enjoy working with PCCI because they're a bunch of smart people.
The thing is that the motivation here isn't making money, it's helping people get better and improving people's lives, because that's what, at the end of the day, medicine is all about.
I think we have some big differences from a typical for-profit technology company. I mean, At the end of the day, we are a natural outgrowth of Parkland, and we really care that we build into this software and indoor analytics the specific concerns for indigent patients and people who just don't have as much stuff and have as much resources.
Our long-term vision is for PCCs to be able to affect you personally.
I think that PCCS has a potential national significance beyond its impact here regionally at Parkland and even in the Dallas-Fort Worth Metroplex. The problem that it tries to address is a universal one.
What's amazing about the Voyager is that it really kind of shows what we're best at, you know, in terms of pushing new scientific discoveries to lead to unimaginable opportunities and approaches to even our understanding of the universe and how we can apply it in the future. Years from now, we want our software and our work to be used around the world in ways that we haven't even yet imagined.